Hi, I'm Dr. Perry Godalovich, and in this video, I'm going to be reviewing the consent form for breast lipofilling or breast augmentation using autologous fat. So this is a procedure that we do very commonly at FI surgery, and it's meant for patients who want to kind of get a 2-for-1, where we take fat from one area that they don't want it and put it in their breast to increase the breast size. This does not give the same type of augmentation as a breast implant because we're limited in the amount of fat that we'll take in the breast. So it's a small to moderate augmentation, never a very large augmentation. It also keeps your breast looking very natural, so you're never going to have a very pronounced cleavage. It's still going to have a very natural shape to the breast. The advantages of the surgery, like I mentioned, is that you have the 2-for-1 where you get liposuction and contouring of an area of your body where fat is resistant to weight loss, and it adds volume to your breasts. Commonly, people who will come for this are people who have don't want to get breast implants or really have an area of fat that they want to remove on their body. This is usually done under general anesthesia if we're going for a full lipofilling, and the procedure lasts about 3.5 hours in 2 positions. We'll place you on your tummy to begin and take out all the fat from the flanks, sometimes the thighs and the back, and then we'll turn you on your back and remove fat from the abdomen, sometimes inner thighs, and place it in the breasts. The recovery is not very bad, usually a couple of days of pain and then a few weeks of wearing the garment. The procedure is not very painful. In the breast, people will describe it like getting your milk in when you've breastfed, and in the areas of the liposuction, kind of having gone to the gym and worked out too hard. The things that people complain about the most is having to wear the garments for 3 weeks. In terms of risk and complications, it is a general anesthesia, so there's the risk of a general anesthesia, which is less than driving in a car. However, we do prevent blood clotting in the legs, which can happen by giving you compression socks, and nausea and vomiting by giving you medication to prevent the nausea and vomiting. In terms of other complications, they're basically the same complications as for liposuction. So liposuction complications are pretty mild, the most common being small contour deformities in the area where the fat was removed, which basically means little holes in the fat. Often these will equalize themselves over 6 months to a year, and this is why it's important to wear the garment after surgery. You're definitely going to have some bruising and some swelling in the first couple of weeks, and that's going to decrease over time and can last easily up to 3 to 6 months. In the areas that we do the liposuction, the skin is going to feel funny, numb, tingling, burning, and that is completely normal. In terms of the breasts, I've never had any serious complications, but complications that have been described are fat necrosis, which is a ball of fat that we've injected that dies off. It can cause oil cysts, which are easy to diagnose because you can just put a needle in them and suck out the oil. I've never had this happen either. Most of the fat that we put in is going to survive, somewhere around 75%. However, when you see your breasts for the first time, they're going to be swollen. So when you see the final result, it's going to look like you've lost about 50% of what it looks like at day 1. But from what I looked at the end of surgery and what you end up with at the end of the day, it's about 75% retention of the fat. If you're looking for a very large augmentation, this is not the procedure for you, and you should explore breast augmentation using implants.